Good morning and welcome to COVID-19 Talk with Local Health Authorities. With us is Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County for now. But good news, you're going to tell us that you're leaving, right?
Well, I hope that's not the good news. So it's been an incredible honor and privilege to be with both of you and obviously to the folks that are watching. But it is true that earlier this week I announced that I have accepted a position as the Secretary of Health for the state of Washington under Governor Jay Inslee. And I couldn't be more honored and privileged to be offered that kind of a position at a state secretary level. That said, I've been just really very tearful, as people know, the two of you know. This has been very difficult because it's bittersweet. You know, you're excited about opportunity, the ability to continue to serve, but at the same time, I'm just incredibly sad to see my friends, my colleagues, my team, the department that we've built, and this community to leave it. But yeah, my family eventually will transition. I'm going to be the first person to transition, and I'm excited about it, but I am also incredibly sad.
Well, you'll be missed, Umair. You will be missed.
But
the good news is that you're going to be with us until you actually leave.
That's right. That's right. So my last day at the county will be December 18th. So I believe we have a show on December 17th. So we'll be there. One more. The day before. There you go.
We expect you to be here.
That's right.
There we go.
On time.
That's
right. That's right. Yeah.
You can't leave early. That's right.
Okay, I got a stack of questions that I got to go through
do
and
it.
ask y'all. This is sponsored, COVID-19 Talk is sponsored by the Rotary Club of Houston. I want to thank past President Kathy Finninger for providing this stack of questions today. A lot more than last week.
Uh-oh.
First, let's go for it. Now, both Pfizer and Moderna said that vaccines would be 95% effective. Realizing the FDA must weigh in on this, many say they will wait to see how high the percentage goes for the next announced vaccine. Your comments?
Well, I would say 95% is actually very high, and so
good.
I think that's fantastic. And I think the thing that Dr. Persse and I have been talking about for months is that it's safety and its effectiveness. And it looks like in these two vaccines that those questions are being answered. And so now it's really about how can they get the approval, how would they go about distributing, manufacturing that much, and then distributing it out to communities.
Yeah, you're not going to get an efficacy rating much higher than 95%. I mean, traditional vaccines are not generally this high. And remember, they're using new technology.
Yeah.
And they've set the bar.
Okay, good question coming up. If having COVID does not provide you with immunity, how will the vaccine do this?
So, good question. So it appears, and there's more and more information coming out about this as we're learning more about it. So we have had stories of people who've gotten reinfected and that their antibody levels went low. Those are small numbers, and it may be that some people don't develop much long-term immunity. But as we're learning that when you think of immunity, there's cellular immunity and there's humoral immunity. And so the humoral immunity is the antibodies, and that is going to drop off after a number of months. That we expect that. The question is, do you get the cellular immunity, the T cell? And it appears now, we're starting to get information that it appears now that people actually do develop long-term immunity. Maybe not everyone, and that's why we're getting these reports of people getting infected twice. But it looks like generally they do. And so the same expectation applies to the vaccine, is that people will get both the short-term and the long-term immunity.
Okay. What about all the different strains? Will the vaccine do enough to help?
They should. I mean, the thing is that, there are strains, but they are pretty close to, where the, initial strain was. And what the vaccine does is it actually gives you enough coverage, enough immunity, enough response of as Dr. Persse said, the system in your body is responding in a way that it should actually give you a response that helps against a number of strains. Now, will it help against all strains? I mean, that only time will tell when it comes to if there are more mutations over time and things of that nature. But what we know is that, and that's the whole reason what we're saying, it's 95% effective, is that it's taking care of 95% of whatever it is those people have gotten.
And mixed in that is that not everybody will respond to the vaccine. That's the other 5%.
That's
is
right.
that sometimes as time goes on, we'll see some genetic drift of the virus, and then you may get a little bit of mismatch, like we see with the flu. But instead of it being annual, it may be every decade or something. We'll have to wait and see.
Right, and the other thing, and Dr. Persse just said this, is that, so even with flu, that if it's not a perfect match, people think, well, then it was worthless. No, it actually gives you enough of a match that it's like the 80-20 rule, that it's enough of a match that it makes sure that you don't get severe illness or complications, which you would anticipate that would be a similar thing with the COVID vaccine.
That's right.
Okay, we'll talk about flu later. For the vaccines that are stored so far below zero and must be used right away, won't that be putting freezing liquid into your arms?
Yeah, no, they get warmed up before you get the injection, so it has to be long-term stored really, really cold. But then they take it out and they warm it up.
That's right.
Yeah,
because otherwise you wouldn't even be able to administer it.
That's right.
It's kind of hard to administer a frozen and a needle. You really can't.
And then you would necrose the tissue you injected into, so all kinds of problems there.
It reminds me of those spy movies where you've seen people shoot frozen bullets.
Yeah.
A vaccine executive, excuse me for that. A vaccine executive said the side effects from their vaccine will be comparable to standard adult vaccines, but worse than their pneumonia or typical flu shots. What could we expect?
So I hadn't heard that it was going to be worse. I heard it was going to be similar. Body
side
aches, some
effects,
pain at the injection site, that sort of thing.
That's what I've heard as well. Yeah.
So
now I will tell you that. So I recently got the shingles shot, and I was told this is going to make me feel really lousy the next day. And I felt really lousy the next day. I got to tell you, it was miserable. But 24 hours after that, I was fine again.
Yeah.
David, I am glad you said that, because I got my shingles shot about my second shingles shot like 2 weeks ago.
Yeah.
I felt lousy too, and I realized that I got the flu and the shingles shot.
That's exactly what I did.
I got the flu and the shingles shot a couple of months ago, and I felt lousy too, and I was blaming it on the flu shot. I think it was the shingles shot.
So I got my second shingles shot and the flu shot, which meant my second shingles shot piggybacked on a bit of immunity that I had from the first one, so I probably had a little bit more of an immune reaction, and I got the flu shot the same day. I was miserable the next day, and then after that I was totally fine.
Thank you for confirming that for me. I have been meaning to ask you that for the last couple of weeks anyhow.
That's great.
So, thank you for joining us for COVID-19 Talk about local health authorities. We'll be right back. I really...
You know what? I felt so bad I went and I got COVID.
Wait a second.
Do you know who I am?
Julia.
Hi. I just wanted to talk to you about what happened with those two girls in 8th grade.
Oh, yeah?
That one day at PE when they were yelling at me, and then you just linked arms with me. I don't think you know how much that helped me, because I finally knew that I had somebody. Jason, let's go see your room.
What do you think? We kept it a little spare, so you can decorate it how you like.
Dinner! Go?
Excellent. Soccer is fun. Yeah, I saw you guys out there. We're the family. We're the family. Help out. Yeah! Oh, I thought you were on my team. Wait.
My Shiro doesn't always wear a cape, but she always has time for a hug, a smile, for going the extra mile. My Shiro stretches every dollar, puts in long hours, puts others first. But now it's your time, Mom. When you're ready to retire, we want you to be able to enjoy it. It's time to start saving now. A free 3-minute online chat can give you the personalized tips you need to start boosting your retirement savings today. Visit aceyourretirement.org/Shiro.
Welcome back to COVID-19 Talk with our local health authorities. Well, we got one thing straight, and that is you can have a reaction to the shingles shot. Right?
Mm-hmm.
That's right.
Okay, because we both did, right?
Mm-hmm.
Okay, for 2 dose vaccines, if it makes you feel bad enough, what's to encourage people to return for a second shot in 3 to 4 weeks, not wanting to get COVID. But go
Well,
ahead.
that's right.
Yeah.
It's because so the whole reason is that the reason it's a 2-shot sequence is that you are going to get some immunity, some improvement by that some protection, I should say, by that first shot. For some people, you're not going to even get it with that first. You're going to actually need to get that second. If you don't get the second shot, you really aren't getting the full protection. You may get some partial. You're taking a chance. Well, that's like the equivalent of doing what we're doing. If you're going to do it right. Get that second one, which then does give you the best chance. It's going to boost the immune system, get you the antibodies, and you are best protected by the vaccine. So yes, one is good, but not good enough. So necessary, but not sufficient. And that's why you got to get that second shot. David, that's the way I would put it.
And the other thing is that, whatever reaction you get to the second shot is probably, it's minimal, right?
And short-lived.
It's short-lived, it's minimal, it's nothing to be afraid of, it really shouldn't be part of your decision making.
That's right.
You just answered that question, the next question, David. Does the second shot typically impact you the same way? Yes, but...
Yeah, it's whenever you get any sort of, even with the flu shot, I've heard so many times people say, I got the flu shot and the next day I had the flu. No, that wasn't the flu. That was your immune system reacting to the flu shot. And that is exactly what you want to have happen. You want to get a little bit of fever, you want to get a little achy, because that's your immune system reacting. So now it is primed and it's ready. So when you actually get the flu, it jumps on and you feel nothing. And again, with the flu, and people should get the flu shot. The thing, I remember being taught in med school, this very stately old professor standing up on the stage saying, you know how you diagnose the flu? And everybody's raising their hands, oh, you get this kind of test, you get that. I said, no. And he said, do you diagnose the flu when the patient says, I woke up feeling fine. By noon, I was so sick, I was afraid I was going to die. And by 5 o'clock, I was so sick, I was afraid I wasn't going to die. And so the take-home point from that is the flu comes on hard, it comes on fast, and it is really miserable. Yeah. So if you get a flu shot and you get a little achy the next night, that is not the flu. The flu puts you in bed.
That's right. Yeah. And the whole thing about vaccines is that it gives you, maybe there's a short-term discomfort, or there's, like you said, I feel lousy for half a day or a day, but it protects you for a longer term. So it's like if I take a blood pressure medicine, it's not always comfortable to take a blood pressure or a big pill or something like that, but if you take it, it gives you that 24 hours of blood pressure protection. This gives you months and months and months of protection against COVID-19.
And hopefully years.
Hopefully years. And that's what we're really looking for. And that's why when effective, safe, getting out there, and we're saying this is it, we want everybody to get COVID vaccine.
Will there be follow-up for those who forget to return for the second shot?
Well, that's going to be probably done on, so whoever you get your shot from, your first shot from, they're going to be responsible for hounding you until you get the second one.
That's right.
When will non-first responders be able to get vaccines?
Well, that's unknown right now because we don't know, first of all, when the vaccine's going to be out there. So remember we talked about get the full approval, final approval. It's got to be manufactured in the amount that it's ready, and it's got to be distributed out from federal to state and then eventually to communities. And so there's a lot in that system. But the answer is that yes, first responders, healthcare workers, those who are taking care of COVID-19, those are going to be the priority. And then you're going to start to see the vaccine available. But it's all about how soon it's going to be ramped up. I would say likely it's going to be in sometime early to mid 2021. So I would say spring to summer, which is March, April, May, June, July.
For the first responders, the priority one people?
No, the second group. Second group. In the summer of 21.
Yeah, I agree.
The new saliva test appears to be accurate. Is it the same as blood sample antibody tests?
No, blood sample antibody test looks to see if you had the illness.
That's right.
Whereas a saliva test looks to see if you have it now.
That's right. And I just got the antibody test I was getting for routine, we talked about this, routine blood work, my PCP, and I said, hey, could you add an antibody test on? And he said, well, sure. And he did, and it was negative, fortunately. But I'll tell you, it gave me reassurance as well. Again, as all of us have, that it gives you reassurance that I know my status, right, and those kinds of things. But again, as Dr. Persse said, it's past infection. Tells you if your body has been exposed, reacted to those antibodies or something to pick up, versus PCR testing, which is, do you have active infection?
Right.
Can we assume that the free testing centers will remain open for the foreseeable future. The FDA just authorized the use of a 30-minute rapid results home test. What is the accuracy level compared with a simple mouth swab at your testing centers?
So that's a two-part question.
Yeah.
You know, so one part is, so beyond December 31st when the CARES money works out, I think we're all strategizing ways to keep the testing sites open. So I think probably need to hold off on answering that one right now.
Well, we can be assured that some will be open.
Yeah, there will be some open. Yeah, exactly whether it's going to look like is yet to be determined. The home test, I did a little research on this last night, and it actually looks like it's fairly accurate. Now it's the same as what we're getting with all these other new tests are coming out. Is that the positives are really reliable. Mm-hmm. The chance of a false positive is not zero, but it's really small. False negatives, yeah. If you've got the symptoms and everything else points towards it and you get a negative test, you need to get another test.
That's right. That's right.
The Houston positivity rate is still creeping up, 7.9, and the county is over 8. Is another lockdown coming, and is there a particular percentage trigger?
So there is no percentage trigger. I think we've always said it's a summation of a number of different trends and indicators. It's what's happening in both the community setting, but it's also what's happening in the healthcare setting and all sorts of other information. Actually, county and city and really combined, we're pretty close. We're about 8% is what I would say. And then we had danced all the way south of 6, between that 5 and 6 mark, and it's unfortunately come up. Look, we've got to do everything we can. I keep using that metaphor. It's a rubber band. Eventually the rubber band stretches and stretches and stretches. But if you do not take action, eventually that system breaks. That rubber band breaks. We do not want to see the rubber band break. We can do things like 3 W's. Wear your mask, wash your hands, watch your distance, and get tested. Like Dr. Persse, get tested. These are things that we can do, everyday things. And we do need to talk about the holidays before we close the show. We can do some very simple things that are going to help our community stay protected against COVID-19.
Okay, Dr. Persse, you said the number of hospitalized patients is going up. I thought we were doing so much better.
So it's a good question. We are. So the number of people who are being hospitalized, the new hospitalizations per day is going up. That's showing that there are more people getting sick. The duration of time that they're in the hospital has come down a lot since July. So there's 2 things. The new hospitalizations is going up, and the number of people who remain hospitalized is also going up, but it's not going up at the pace that it was back in July because the hospitalizations per patient is reducing. So I'm sorry if I confused anyone.
Hospital days per patient.
Yeah, hospital days per patient, right.
Thank you for joining us with COVID-19 Talk with local health authorities. We'll be right back.
As society reopens, it's important that we continue to wear face coverings. Here's how you can make your own in a few easy steps with items you can find around your home. Old scarves, bandanas, hand towels work great. You can also take an old t-shirt by cutting it into a square. You fold it to the middle from the bottom first, then fold it to the middle again from the top. Then fold it again to the middle from the bottom, and once again from the top. Then place a rubber band around both ends. Then fold it to the middle. Make sure it fits snugly over your nose and mouth. And it's just that easy to mask up, Houston.
You're the engine that makes all things go, and you're always in disguise, my hero. I see your light in the dark, smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, no, I love you for that. Honest and selfless, I don't know if this helps it, but good job, you're doing a good job, a good job, good job, you're doing a good job. Don't get too down, the world needs you now. Know that you matter, 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 yeah.
Welcome back to COVID-19 Talk with local health authorities, sponsored by the Rotary Club of Houston. Is the asymptomatic number still at 40%?
Actually, I've seen 40 to 50% is the number. Yeah.
Yeah, it's at least, as the people getting infected become younger and they tend to have less symptoms, it's actually greater than 40%.
TA guidance allows districts to bring low-performing students back to learn in person. Are health officials weighing in on this, or do the ISDs have complete control?
Well, we are able to, if there is an outbreak or there is, some COVID-19 positivity, we are able to close schools, but really it is TEA that's giving the guidance to the school districts, and then the school districts based on what they're doing with the schools themselves.
Yeah.
Many states have regulations about people who come into their locations and require quarantine. What do you recommend for Houston and Harris County, and do you have any leverage on a decision on preventing people with high positivity rates to enter the area?
Yeah.
Well, I would say a couple of things about that. One is that, there are communities that are doing that. I don't know how effectively they're enforcing that, because I see that as being incredibly difficult to enforce. The other thing is that if you're in a community that has really low values, positivity rates and infection, that may be worthwhile. I think today, we're in the 8% range. It would not be helpful. It would be a waste of effort that could be better focused elsewhere.
That's right.
Yeah. More and more, I see people going into the grocery stores with the mask on and then take it off when they get past the door. Store employees seem reluctant to ask for masks to be put on. And on social media, I've seen people say they just say it's for medical reasons. Shouldn't they have to at least wear a shield?
Okay.
Well, I don't think it's the issue about the shield. I think it's about why are we asking people to wear masks? And we're asking people to wear masks because it protects not just the persons around you, but the person who's wearing the mask. And we're in the middle of a pandemic, and I think this is what David and I have been talking about since the beginning of this pandemic. Is unfortunately we have politicized something as simple as a mask, and we have politicized something as simple as fighting a pandemic. We should all be united against doing that, against a virus.
Yeah.
And unfortunately, that's the challenge.
Let me add one little thing. Sorry, the shield alone is worthless.
Yeah.
So just the shield alone is worthless. Waste of time.
Who exactly is enforcing wearing masks?
So in the city of Houston, HPD is, and they've been told to provide a mask, tell them to put it on, and if they continue to refuse, then they can take action.
And at a state level, it's the governor's orders about mask wearing in public settings. Yeah.
Curious whether the firefighters who are in quarantine are coming down with COVID at work, since they work in such close quarters, or from home. Do we know?
So we do have investigations to everybody who comes in who turns up positive. We try to figure out where they get it from. Very often it's difficult to know, because here's the problem: is a lot of our firefighters work other jobs where they're also at high risk, because they work on private ambulance companies, they work in MRI centers, they work in other places that put them at high risk. So sometimes it's difficult to know exactly where they got infected. But an investigation is done with each case. Okay.
How are homeless shelters doing during this pandemic?
Actually, there have been some issues in some of the the homeless settings. But I'll be honest that a lot of them have actually taken a really incredible amount of precautions and worked with the various health departments. I know Houston Health, you guys have done a lot of work within the city limits. And really it's I would have anticipated you would have seen more, but I think it's really a testament to the preventive efforts they've put in place.
Yeah, I think a take-home point from that is sometimes we talk about a controlled setting versus an uncontrolled setting, right? And in a controlled setting, you can really minimize the spread of virus. And we're talking about a party, a restaurant, a homeless shelter, if you control it. And so we've had the homeless shelters who've done a good job of controlling it, have had very few problems. Uncontrolled settings, it's uncontrolled.
That's right.
Not that a visit wouldn't be welcome, but what is the story about random visits from Harris County requesting blood samples? Is there a arrival at our door the first alert, or will we receive a county text? We know you have our numbers since we received a text on Tuesday.
Yeah, so this is actually, it's very similar to what you all did in the city of Houston. And, I think unfortunately some people have voiced concerns thinking that we're going to just take blood without really any permission or anything of that nature. That's actually not furthest from the case. I mean, what this is really is knocking on doors and asking people if they're willing to participate in a very voluntary way. If they say no, they go away. So So that's really and the reason for the text was really the judge wanted to make sure, county judge and our Office of Emergency Management, to make sure that people were ready for the holidays and making sure that they understood the kinds of risks that they have if we don't do the things to protect ourselves. So two unrelated things.
And we'll talk about that hopefully in the last minute or two. New vocabulary for me: sustainers who maintain antibody protection for longer periods and delays, and delayers who do not retain antibodies is what you are the luck of the draw.
Mm-hmm.
Yep.
This autonomia is the umbrella term for conditions that impact our autonomic nervous system. These symptoms greatly resemble coronavirus symptoms and lasting effects. Is there a connection that you've heard?
Well, so for example, like the GI symptoms, we've heard a lot about GI symptoms from people who got COVID, and we've also heard about people who have lingering symptoms. I don't know that, dysautonomia is a separate, independent, medical condition. I don't know that COVID is mimicking it or aggravating it.
Yeah, there's been some correlation, but there is no causation, so we don't know if it's causing it.
Okay, the Lancet indicates that COVID patients were twice as likely to develop a new mental illness within 90 days of their diagnosis. Why? I hadn't heard that, have you?
Well, there's two things. One is the psychological, the sort of neurologic effect and all the things that we've talked about over the months around COVID-19. The other is just the behavioral challenges that, that you're COVID-19 positive, and then there are some psychological effects that it's having on a lot of people after the fact.
Okay, this question, another difference between flu and COVID seems to be what is called delirium. And the question is whether this is one of the long-term effects after COVID.
What was the effect?
Delirium, and defined as a wide range of cognitive issues related to memory, concentration, sleep issues.
Right, we're finding it more in COVID than we were in flu, so that's another reason why I'd prevent COVID in the first place.
Okay, next week is Thanksgiving. We won't be here for Thanksgiving, and enjoy your day off because I know y'all have been working hard. I want you to maybe give some folks some parting advice for celebrating the holidays.
Yeah.
I would say first and foremost that, look, for those who can not have Thanksgiving the way, around all the dinner table, all those things, don't do it. Just have your immediate family, your social bubble, do it outdoors, all those kinds of things. Don't travel if you don't have to. So if you can sit anything out, this is the time. But if you can't and you want to do something, please do it safely. We've got tips on both of our websites. Do it safely. I think the key is either don't do it. If you're going to do it safely.
Yeah. David?
So I'm going to tell you, so in my family, we're, it's going to sound like I'm being, I'm not taking my own advice, but we're going to have family over. But that's because we haven't seen our daughter and our grandchildren since January. And so we're doing all the preparations now. And so this right now is the most human contact I'm having. I'm doing everything by Zoom. Yeah. And so this moment right now is my greatest risk for the 2 weeks leading up to it. And so we're going to be celebrating outdoors. We got a huge space to do it. I'm going to be the sheriff. But I think, it's kind of balancing. Like I said, we haven't seen our grandkids since January. Right. And
so just be smart about it. Yeah. That's the key message.
Let's take the advice of our local health authorities regarding celebrating Thanksgiving. I want to wish all of you a happy Thanksgiving. With us for the COVID-19 talk, sponsored by the Rotary Club of Houston, has been Dr. David Persse, the new sheriff.
At least in the house.
The city of Houston. Dr. Umair Shah of Harris County, soon to be of Washington State, Secretary of Washington State, that is. I want to thank you to past President Kathy Finninger, Rotary Club of Houston, for providing us with these very good questions from week to week. I am Stephen Williams, Director of the Houston Health Department. We'll see you in 2 weeks. There it is.